Hi, this is Dr. Sham. Welcome to my YouTube channel. Going to talk about today the OET medicine writing, OET writing for the doctors. So we all know that there is only one letter given the case notes and have to write a letter. And there are three types of the letter: referral letter, discharge letter, transfer letter. Most of the times, above 90%, it's a referral letter, and quite a few number of times it's a discharge letter, and then to a lesser extent you might encounter a transfer letter as well. But nevertheless, the things are more or less the similar. The important thing over here is that there is more than one ways of writing a correct OET letter. And I'm going to tell you one correct way out of all those correct ways. So your letter is that it's divided into the three portions. Okay, the first portion is where you write the name of the doctor and the address and the information about the patient, then your paragraphs, and at the end it's your ending, and that's your name written over there. So first of all, let's start from the beginning. This is something that is given at the end of your letter: the name of the doctor which you are writing, the address, date, you put today's date, and then the doctor name and the patient's information. Let's discuss it now in a little bit detail. So first of all, you write the name. Here you write the full name of the doctor, what is given at the end. Important thing over here is that some people they write doctor and put a dot. Is it okay? Yeah, it's okay. But if you are putting a dot over here, then you need to put a dot everywhere down there where you are writing a doctor or a mister or something. So you have only one letter. You need to keep this thing in your mind. You are not going to, if you are going with a variety of the things in this intro, this is not going to impress somebody. Your correct way of writing is going to impress somebody. Okay, but if you are doing something experiment and you're going to write the wrong, that is not going to impress them, but that's going to result in cutting your marks. So try to keep it as simple as you can. So I don't put a dot over here so that I have not to put dot anywhere, because sometimes you miss the things. So that's the first thing. The second thing is you can't see any comma here. No need of that. Okay, the third thing, coming to the date, when you're writing the date, leave a space over here and then write a date and then leave a space over here. Okay, and then write the other things. Now coming to the date, this is the simplest way of writing the date, and it cannot be wrong. The people go like 10 Feb 2014, fine enough. If you are confident in that, go enough, go for that. But I would recommend you keep it as simple as you can. Okay, and that should be correct. Okay, this is a simple way, everybody knows that that's right. So why to do some experiments where you do the things wrong? To keep it very simple over there. Okay, then you leave a space here, and now you write dear doctor and always write the second name. All, there's no need to write now the full name here, and here comes your first comma. Okay, you need to put over here, and then you write re Mrs. Priya Sharma, like what's the name of the patient. Then you put a little comma here, and then you write the date of birth exactly. And if you see here, I have kept it similar to that. Very simple, straightforward. Now, the next thing is that sometimes you are given the age and no date of birth. So how you gonna write that? You're gonna write that aged, similar like, okay, here you have written, say for example, read this whole statement you have written over here. Say for example, then you can write aged and 48 years. Enough. 48 years, that's how you're gonna write. So this is Mrs. Priya Sharma or whatever the name is. Okay, and then you write the age like this over here, this one down here. So this is a simple structure of your intro. So this is containing all the information about the patient, about the doctor you are writing. Okay, Now next move to the main paragraphs. Okay, the paragraphs of your writing, um, the OET letter. So I always divide into the paragraphs. So if you see over here, this is an intro paragraph. So these are now paragraphs. The first one is your intro paragraph, and this is the most important part of your letter, because here you are going to tell the basic detail about that what you are going to write below. So I always say to the students that apply a rule of three here. What's the rule of three? The rule of three is, the first thing is that, okay, have you sufficiently explained that what you are doing here, what the patient is and what the problem he is having. So let's analyze this. I'm writing to refer, so you're referring the patient. This is the patient whose signs and symptoms are consistent with, say for example, meningitis. So I'm referring the patient. This is the lady with meningitis. So I have told what the problem the patient is having, and I'm referring the patient. This is the one. The second thing is that you need to tell the doctor specifically that what you want to do. Okay, what you want from that doctor. This is the rule number two. And the third thing is you need to ask yourself, have you explained sufficiently and correctly the patient's condition and what you want from the doctor? And have you included anything that is extra? You considered it from yourself and you added that one. So you need to avoid that one. So there are the three rules. The one rule is that, and you get this thing from the end of your letter, okay, the plan and the things, and this is how you're going to tell it that one. So if you are referring a patient is having this problem, this is one thing, okay, the rule of one, what the patient problem the patient is having. The second thing is what you want that doctor to do. And the third thing is, you need, after writing all that, you need to ask yourself, have I sufficiently told that doctor what was given to me according to what is given to me? It's not like you are satisfying yourself. What is given to you? And have I included something which should not be included? Like, say, for example, it said that refer to the doctor for a CT scan, and you are not writing a CT scan and you are writing for further assessment and management. This is not asked. This isn't asked over there. So you are writing about the assessment and management. It was about the CT scan. You are referring a patient about the CT scan. Okay, if it's written further assessment including a CT scan, write like a further assessment including a CT scan. Don't go for further assessment and management, putting something from yourself which is not there. And then if it's asked that further assessment including a CT scan and you are only writing your further assessment would be highly appreciated. So you are missing something which is given over there to you. So that should be strictly according to your case notes. Again, I'm summarizing this intro paragraph. So very important, because here is the examiner is going to make up his mind that what you are talking about below. So the patient you are referring or whatever, then are discharging, then what the patient, the problem of the patient, and then what you want that doctor to do. Okay, and third thing, you need to ask from yourself, have you included something extra, have you missed something that was important and was given over there? So that's your intro paragraph. Now the next paragraph is a history paragraph. Here you tell about a history, like Mrs. Sharma. You know write the second name. It's fine enough. You have already written the first and the second name of the patient above. Here you write now the second name, more than enough. And you include something like Mrs. or Mr. here. Okay? And if it's a miss given at the bottom of your case notes, write the miss, otherwise like Mr. or Mrs. You're gonna put that. So here you need to explain a little bit of the history of the patient, which is given, the relevant history. Now, the problem here is that if this history is like 2 3 lines, write it like a paragraph, history paragraph. If it's only a one line, don't write it over here just as a one line, okay? Then you need to include this history into your first visit paragraph. So this is your history paragraph, and this is your visit paragraph. Starts visit paragraph. Now your visit so if your history is like 2 3 lines, okay, then write it as a separate paragraph. Otherwise you can include, if it's just a one liner, that's not going to make a paragraph. Just write it at the end of your first paragraph. Okay, so this is just a history you have written. Now coming to the visits paragraph. So always start from initially, keep it simple. Initially, Mrs. And up to now over here you have seen that I have written the name initially. When you start a paragraph, try to write the name of the patient, at least up to your first visit. Then you can write she below. If you have really long paragraphs, try to start the paragraph with the name and then you can write he or she below that. But if there's a smaller one, at least initial up to initial paragraph, write the name of the patient. Don't write that initially she presented to me. Write the name and then you can use he and she below. Now, the thing is that this is your paragraph, okay? So this is the first paragraph. Say, for example, there were the 3 visits. This is the first visit, second visit in a second paragraph, and today's visit is always in a separate paragraph. Always write in a separate paragraph. Let's analyze. You have 4 paragraphs. So you can combine 1 and 2 in the first paragraph, 3. These are visits paragraph, okay? These are visits paragraph. So 1 and 2 you can write in this paragraph, first paragraph, 3 in this paragraph, and today's visit always separate. Now there are 5 visits. How are you going to write that? 1 and 2 you can combine here, 3 and 4 you can combine here, and the final paragraph is going to stay here. Say, for example, there's so many paragraphs. Then what you can write, you give the basic information like in the 1 or the 2 paragraphs maybe, or 1 or 2 combining here, and then you can write something like, in subsequent visits she presented or represented with her similar complaints of headache, whatever. If you have like 5 6 7 paragraphs, so you write 1 or 2 the main paragraphs, okay, and then you can write another paragraph like the second paragraph of your visits paragraph is like, subsequent visits she presented with this are subsequent visits, and subsequent Mrs. XY presented with this and that. And the today's paragraph, this is always a separate paragraph. The next important thing about this paragraph is that when you are writing a visit paragraph, what happens when a patient comes to us? We take a history, that is the complaints of the patient. We examine the patient, and then what we do, we run the investigations, and then we manage the patient, means the treatment, and then we can refer, or we book the patient for revisit. So keep this thing in your mind when you are writing a OET letter. Okay, that initially Mrs. X presented to me with the headache. Examination showed. So, for example, anything you can write. Okay, um, the neck stiffness. Okay, therefore, a CT scan brain was advised, and she was commenced on this, and that. This is just giving you an example. This is not logical, I know. Okay, like about the diagnosis, but this is I'm telling you an example that initially. Okay, let's make it. Initially, Mrs. Sharma presented to me with a headache and neck stiffness. Examination showed Cunning sign was positive, say for example. Therefore, an LP was advised and she was commenced on antibiotics. Now, this is like making a story, and I use the word therefore. This is like a connector. This means the patient came with this complaint, and this was the examination finding. That's why, don't use that's why, just trying to make you understand. Therefore means, therefore, I don't write the I as well. I'm speaking that intentionally as well, because don't write the I. Okay, that doesn't go, except this I you have written over there. So don't use, try to avoid that one. Sometimes you need to write, but try to avoid that. Therefore, she presented with this thing. Examination findings were there, and that's why LP was ordered and she was commenced on this. Now, this is like a story. Make it like a story here and try to use connectors. Therefore, okay, however, like examination was unremarkable except for high BP or something like that. Try to use the connectors because that's gonna make a story. That's gonna make a story. Now, one very important thing which most of the students encounter, like if there are 4 5 symptoms: headache, nausea, vomiting, diarrhea, leg pain, how are you going to write that? Mrs. Sharma presented with, or Mrs. X presented with headache, nausea, vomiting, diarrhea, and this thing. No, that's not something that looks good. So how you can write that, I'm going to tell you that when you use a connector, how the things become fine and they look fine. So I could write like this, that Mrs. X presented with headache, nausea, and vomiting. I put a full stop. Also, she the, initially Mrs. X presented with the complaints of headache, nausea, vomiting. Also, initially she presented with this. Also, she complained of leg pain and headache. So, by using this, also you need to put a comma here. So you have broken down your 5 6 symptoms, okay, into 2 sentences, and that's gonna make it look nice. Otherwise, like, so headache, nausea, vomiting, diarrhea, and maybe a couple of more. So that is another thing which I want to mention over here, because the people, they get problem when they are having like 5 6 symptoms over there. So you can use this also, and you can break that down. Okay, she revisited, or you can start from Mrs. Sharma, Mrs. XY revisited on this and that. Okay, and then below there you can write, okay, she and all that. Today's visit is always a separate visit. Now let's go to the letter. Here you can see, so I have written in intro over here containing all the information. Then this is your intro paragraph. Remember the rule of three. This is your history paragraph. Write it as a separate, or just merge it at the bottom of the first paragraph. It's just a one liner. Then these are your visits paragraph, and I have told you, if there are three, write 3 paragraphs. Today's paragraph is always a separate paragraph. If there are four, 1 and 2 you can combine, 3 here. Or if the one is big one, write 1 here, 2 and 3 you can combine here. And the today's is a separate. If they are 5, then you can combine 1 2 3 4 here, and today's paragraph is always a separate one. If there are more than like 5 6 7 paragraphs, then try to write a one paragraph where you explain all the things, and the other paragraphs you can write in on subsequent visits, and today's paragraph stays the same. Now at the end, this remains the same. If you have any queries, feel free to contact me. Please let me know in case of any queries. And you yours sincerely, and you write your name. Now the people, they forget writing their name. They just write doctor and they leave it. Don't leave it like that. Write doctor and write your name over there. So this is a simplest way of writing an OET letter in the correct way. Hopefully that's going to help. If you do have any questions, any confusions, you can write down in the comments. I will try to answer that. Thank you.